Let me begin first with a foundational framework, and that is our bottom line, that learning in the state of California is simply non-negotiable, that schools must, and I underscore must, provide meaningful instruction during this pandemic, whether they are physically opened, the schools, or not. And that's what I want to talk about specifically today. Our students, our teachers, staff, and certainly parents, we all prefer in-classroom instructions for all the obvious reasons, social and emotional foundationally, but only if it can be done safely. As a parent, I believe that. As someone that has a responsibility to help support the education of 6+ million kids in the state of California, I have the backs of our staff, our teachers, our school nurses, our counselors, our guidance staff, principals, bus drivers, janitors, all the folks that are responsible for the caretaking, the safety and the health of our children. We have to have their backs as well, including, obviously, the preciousness that is our children and the kids in our education system. But safety is foundational, and safety will ultimately make the determination of how we go about educating our kids as we move into the fall and we work our way through this pandemic. Here is the 5 principles that we are laying out in terms of our expectations. Here is our pandemic plan for schools in the state of California. Number 1, safe in-person school based, again, if you're going to be in person in the school, based upon local health data. And I'll walk through that bullet point in more detail in a moment. We have new mask requirements that we are putting forth today, some clarification and some constructive guidance on physical distancing and other adaptations that we expect to see within the school setting. We're putting out specific guidance as it relates to testing and contact tracing in our school system, and what we mean by distance learning. And the word rigorous is foundational. If we're going to have distance learning, and we will, to make sure that it's real, that we address equity, we address the divide, and it's quality. It's rigorous distance learning. Let's talk about number 1. Using data, using the foundational data that we have laid out county by county all throughout the state of California. We are now putting forth guidelines that say schools can physically open for in-person education when the county that they're operating in has been off our monitoring list for 14 consecutive days. If you've tuned into these daily briefings, you're very familiar with our monitoring list. I'll be updating that list later in the presentation today. But we are now putting forth guidelines that say, based on the data, based upon the background spread, the community spread of the virus, that if you are not on that monitoring list, you can move forward as a county if you choose to physically open your campus, physically open your schools. However, schools that don't meet this requirement, they must begin the school year this fall through distance learning. Number 2, and I'm going to get to that in a moment. Number 2, we're putting forth a new mask requirement in the state. All school staff and students, all staff and students in 3rd grade and above must wear masks. Students in the 2nd grade or below, we strongly encourage wearing masks and face shields. I have a very young son, Dutch, and caregivers, when he first saw masks, he naturally recoiled. A lot of caregivers now have face shields, and he can see their expressions, their humanity, and that's why we put specifically guidance out as it relates to not just masks, but face shields as well. Our 3rd frame of guidance that we're putting forth today is around physical distancing, and as I mentioned, other adaptations. So on the physical distancing side, we believe that it's incumbent upon staff to maintain at least a 6-foot distance between each other and a 6-foot distance between themselves and the students. We believe that school day should start with symptom checks, meaning temperature checks. We have robust expectations around hand washing stations, sanitation, deep disinfection efforts, and that these schools have, along the lines of the adaptations, have quarantine protocols. And we'll talk a little bit more in a moment about these continuity and attendance plans that each school site is now responsible for putting forth. As it relates to the issue of testing, there's a requirement that we test on a rotating basis a cohort of staff on a consistent basis. Dr. Galley will talk a little bit more about that. And in turn, we are bringing to the school system the benefit and support of the 10,000+ contact tracers that we have trained here in the state of California in partnership with UCSF and UCLA with a backbone and a database that now has organized a collective. We want to turn our contact tracing where we think it become very effective in these school environments, could be very effective in mitigating the spread and trying to understand exactly where and how the spread had advanced, and allow us obviously to isolate and quarantine cohorts of not only children but staff as it relates to mitigating that spread further. As it relates to distance learning, as I said, rigorous. Access to devices is one thing, and connectivity, it's foundational. And in a moment, I'll talk about the money we have put up to allow for districts to purchase new devices to get the kind of connectivity that our students need and deserve to address this yawning gap as it relates to the digital divide. We want daily live interaction with teachers and other students. Students connecting peer-to-peer with other students, teachers connecting daily on an interactive frame to advance our distance learning efforts. Remember, we had a lot of experience that came through the spring this year. We reviewed a lot of the fits and starts related to quality, access issues, points of consideration and concern, shared a lot of those best practices. No one is going to deny that based upon the early orders to start to close schools at the local level, that some of it worked more effectively in certain parts of the state than others. Clearly, we have work to do to make sure that we are doing rigorous distance learning, but this is the predicate, the foundation. These are the expectations that we have, minimum expectations in terms of quality, engagement, connectivity, and access to the devices that are foundational in terms of providing for quality distance learning. We also want to create a challenging environment where assignments are equivalent in terms of what you would otherwise get in an in-person class setting. I'm not naive, and again, we stipulate, that second slide I showed, that staff, that teachers, that parents prefer the socio-emotional learning of in-class education. That is a default, that's our bias, but under the circumstances with the spread of this virus, and I'll get to that spread in a moment as an explanation again as to why at this moment we're putting out this recommendation, that we want to do our best to create some sense of equivalency with the obvious constraints that is distance learning. We also want to make sure that we are always mindful of our students that are homeless, our students that are foster care kids are in the system, kids with English as second language, and those with learning disabilities, those that have special needs and the like. Look, that foundation is laid, was laid rather, with the legislature and the strong support we received from the legislature when we put forth a package on equity that was approved. That package includes $5.3 billion to deal with learning loss that was associated with some of the closures last year, and a very, very focused and intentional effort to meet the needs of those, again, that fall into those categories of special needs in our system. So $5.3 billion was put in additional funding to prioritize the issue of equity. So it's not just a throwaway line, it's not just a catch-phrase, it's not just something we put out to promote a point of view, but we're substantively putting real resources and heft into advancing that point of view as well. So the question a lot of people are asked or rather begin to ask is, all right, once our school is open, what happens if the spread goes into the classroom setting or in a district setting, or if the spread continues in the county unabated? And so this slide puts forth some criteria that we are setting forth. Again, these are brackets. And within these brackets, we'll work through with the county and all the local conditions and recognizing the nuances and the gray areas that are part of a system as large as ours, over 1,000 school districts here in the state of California, in addition to all of these county superintendents and all of these local districts and cities and counties and all the jurisdictional criteria. It makes this, unlike any other state in terms of size and scope, challenging. But nonetheless, here's the minimum expectation in terms of expectation to consult with public health officers first if a classroom cohort has to go home because there's a confirmed case. If a school goes home with multiple cohorts that have cases, or we stipulate 5% of the school, local school, not district, local school is positive, then it would trigger criteria to consider closing, or mandate rather, the closure of that school site. However, one school does not make a district. And depending on the size and scale of your district, this could be multiple schools or just a few schools. If they have similar cohort caseloads, we then have a stipulation here, mandate that if 25% of the schools that compose of a district have positive cases that reach that threshold, that they need to be closed within a 14-day period. So that's the foundation that we're laying out today on public education guidance. As many of you know, we put out guidance to the Department of Public Health, California Department of Public Health, some time ago. There's a lot of local guidance. You have CDE, which is the California Department of Education, that put out guidance as well. The purpose of today is to try to lean in from a health and data perspective in terms of our expectations, public and private schools in the state of California, expectations, mandates with the flexibility that recognizes each part of the state is unique. Each part of the state is distinctive. Some counties are on the monitoring list for a good reason. Others are not for an equally good reason because they're not seeing the outbreak and as a consequence are able to do the in-person education. But even those that are currently on the monitoring list, we hope and expect as we mitigate the spread of this disease, they'll fall off that monitoring list, and we've created the parameters and guidelines over a 14-day stabilization period to then reopen those schools and allow that as an option to local education entities in partnership and counsel with public health officials to make that determination as to what is best for their children and those that support our children. Remember, public education, education broadly, is absolutely about our kids, but we cannot deny the fact that we have hundreds of thousands of adults that are responsible to taking care and educating our kids as well, and their health has to be considered as well. And I just offer that as a parent, but as someone who has reverence for our principals, for our teachers, for our janitors, for our bus drivers and others. And I am entrusted to be accountable and responsible to their health as well as the health of my children and your children and our children, our future.